Hi, my name is Tristan Wayne Liu. I work with the Geisinger Wyoming Valley Hospital, and this is a presentation on monkeypox and pulmonary complications, leading cause of mortality, a systematic review. The monkeypox virus of Orthopoxviridae family has been a cause of global concern after it was designated as a public health emergency of international concern on July the 22nd, 2022, by the World Health Organization. Public health systems have been greatly put under pressure with this disease. It is typically found in human and non-human primates and remains endemic in Central and West Africa. Majority of these monkeypox cases in these populations involve the MSM community, often manifesting as atypical clinical presentations along with co-concurrent sexually transmitted infections. While significant monkeypox outbreaks occurred in African countries since 2017, the populations have been neglected with lack of investments in surveillance, vaccination, and disease control despite high transmission rates. The leading cause of mortality in monkeypox is still unknown. However, it is our hope in this study that we suspect it will be possible pulmonary complications, which is the reason why we are doing this systematic review. In these two images, here are the most common presentations of monkeypox patients that we have dealt with. As we see on the left in image 1 is typical ulcerative lesions in the perirectal area, and on the right we see a monkeypox lesion on the chest. We performed a systematic review of cases with monkeypox and lung complications. Database used were PubMed, Embase, Cochrane, and Google Scholar. Mesh terms used were monkeypox, pneumonia, bronchopneumonia, or lung. Additional Google Scholar search was performed using the term monkeypox, pneumonia, with restriction to results in 2022. A total of 103 articles resulted in PubMed, 0 in both Cochrane and Embase, and 172 in Google Scholar. PRISMA checklists and protocol for systematic reviews were followed in our study.
Hi, I'm Rohit Sharma, MD, one of the authors for this systematic review. In this particular image, which is a CT scan and a PET scan of non-human primate, particularly macaque, we could see in the CT scan, especially with the red arrow which depicts hazy attenuation and blue arrow which depicts consolidation in monkeys that were infected with monkeypox virus leading to pulmonary complication. This particular subject did succumb to death after monkeypox infection. We come on to the results. So literature and research work regarding systematic complications, especially relating to lungs, is clearly lacking. It was very striking to note that there's no clear cause-specific mortality data noted, especially due to pulmonary complications in our systematic review, which included literature review on and before 2022. WHO Smallpox Eradication Unit in 1988 reported that there could be case fatality rate up to 9%. CDC in 2022 reported that mortality rate could range from 1% to 10% in cases with monkeypox. There was a study that was done with macaques infected with monkeypox virus, which noted that there is increase in inflammatory protein alongside a decrease in metabolic and structural proteins in the lung fluids in macaques. Another study noted presence of monkeypox viral DNA and antigen with the presence of inflammatory necrotic tissue in lungs of cynomolgus macaques. Another study noted that death in cynomolgus monkeys was predominantly occurring due to fibronecrotic pneumonia at 9 to 17 days post-exposure. So concluding, animal models have suggested that there's a potential of monkeypox virus infecting the lungs more so as compared to smallpox virus. It is hypothesized that mortality occurs due to pulmonary complications, particularly due to bronchopneumonia and fibronecrotic pneumonia. While data remains unclear, it is prudent to keep a high index of suspicion for lower respiratory tract infections in patients who present with typical history and rashes. Here are some of the references that we used within our systematic review. On behalf of our team, including all the authors, I thank everyone to listen to our presentation and poster. Thank you.